So the students say that having a balanced meal is what you need to do in addition to have the routine cleaning, hygiene of your mouth. Because those food play an important role in making your mouth healthy, your oral health is very critical as part of your well-being. A balanced meal is having the 5 food group in mind. Because when you choose vegetable or fruit, you may get stuck in that particular food that you won't have in the meat. So if you get the meat, you will get something that you may not have, you don't have in the vegetable or fruit. So by having both, you end up having almost the whole area of what you need for your body health. And we're going to talk about that in a minute. Okay, so today we're going to talk about what we eat, how often we eat it, and the way we eat it, a particular food will really affect how healthy our mouth is. So your oral health, actually, it is really comprised of your teeth, your gums, all the different part of your mouth. But we're going to focus on the gum and the teeth today. Okay? Any question before we move on? So, like I mentioned, this is what we're going to cover. We're going to look at a topic and they're saying, hey, I'm telling you to, or the third A is telling you to eat a balanced meal. Why? Why that food has to be, if I brush my teeth every day, plus what do I have to really have to make an effort to go choose a balanced meal? We want to see the link. We also want to see why that we are prone to carry, why that we have those risks, what food actually or behavior actually increase that risk of us having carried. And then we're going to have some exercise between to be able to illustrate that. So you know that, hey, I'm having a pain in the teeth, it's not fun. So you miss your friend, you can go to school, they're playing the game, you know, there. And so it's like any part of your body that is hurting, your mouth also, when it is in stress, like having toothache, prevent you from enjoying your everyday, even prevent you to some extent from eating the food you want to eat or the food your body needs. It is very important to really take care of your teeth and your mouth. So I have a lot of activity to illustrate things. So I'm going to pass that to a few of you because I didn't have for everybody, but you will follow, okay? I'm going to leave 2 on this wall here.
The schoolwork I've done.
I gave you
Does he know he
different items.
Man, I don't want no candy.
If you have one, tell me what you have in the food or not, and where is it?
Oh, we should share that free.
He must have did. Are we supposed to? Is everyone supposed to have one or no?
No, we might not have a, we might not be enough for everyone to share.
You don't have to have one.
Yeah, just share.
Okay?
Oh, I get
Whatever you have, if your friend on your row, tell me if it is a food or not.
Food or fruit?
So, what you have orange juices, you have meat, you have water, you have apple, you have cucumber, you have probably carrots, you have smoothie.
I wonder if you feel like seasoning.
I think you have cookies. Yeah. If you have an item that you think is food, where is it? Carrots, cucumber, cookies, apple, avocado, donuts, salad mix, vegetable mix, sandwich, chips, Someone say apple juice.
Oh, wait.
Apple juice, yeah. Apple juice. Someone say apple juice. What else?
Is apple juice a food?
So what is food?
I think it's in digesting.
Who want to share the other thing? What do you think apple is a food?
Because it's nutrition.
Okay. What about milk?
Milk, I don't think it's a food. No, some people can't digest it.
Okay. So you know, apple is the food because it's nutritious and the milk is not because some people cannot
I'm
digest it.
lactose intolerant.
Okay. Okay. How do we define food?
Something that we can break down to give us energy.
How do we define food?
Could you repeat the question, please?
How do we define food? What is food? Why is that?
Vessel which we receive calories.
Okay.
Just something you.
So, yes,
Anything that gives us nutrition for the body.
okay.
That's what something you digest.
So if you have apple and you have milk, which one is a food?
The apple.
Apple.
Milk is what?
A drink. A drink.
Exactly.
Solid digestion.
Okay, so as a dentist, future dentist, when you talk to your patient, you're going to tell them what to drink or what not to drink, and what to eat as food and what to limit as food. Okay, I want to make the difference because those two have an impact on the health of the teeth. Okay, so if you look, if we go for what I have, you have drinks, those are food because we can chew them. By definition, a food is something that we chew before swallowing. So carrots, cucumber, banana, avocado, those are the things. The snacks that people tend to really aim at also are food because we chew them. And we don't talk about that particular type of food because they tend to stick on our teeth and increase our risk for caries. Smoothie. It is a mix of vegetable, right? You say vegetable are food, but is smoothie food? No. Because it is not so much the whatever they have, it is that whatever how we consume them. So we drink smoothie, water, milk, and so forth. Are drinks. Someone who raise soup. Who has a soup? Soup is something that is both. Because you can have tomato soup that doesn't have anything inside, but you can have those chunky noodle chicken soup that you need to chew in addition to drinking the fluid. Okay. So think about what we're going to talk about later on.
You got 8%.
When I gave you the different handout, so we have orange juice, we have water, we have milk, we have soda. Among the four, which one will be the yes column?
The orange.
Water. Orange juice. Did you say?
Will be the yes column. So the yes column we say it is orange juice,
Water.
Yeah,
water,
And
milk.
milk. What about the no column?
Soda.
Okay. There is a gray area in the middle that I will put orange juices and the chocolate milk that I pass it on. Because those orange juices can have a very high acid level. The chocolate milk, although it has milk, it can have too much sugar added to it because of the fact that it has chocolate inside. So here is some examples. We don't see the picture here, but that's what I mean. So the first one that we have basically is comparing milk, okay, Okay, comparing milk and soda. So the milk we have sugar, vitamin D.
Sorry, could you speak up just a little bit louder for the students that are on Zoom?
Okay.
And then just repeat what pictures you're showing, just so they can know what, what's.
Okay.
But yeah, they're having a hard time hearing. Okay. Thank you.
No problem. So I'm comparing the first one, unfortunately, don't see the image. The first one I'm comparing your regular milk. It can be whole milk, it can be 1% milk, 2% milk, and skim milk. Okay, I'm comparing that milk to your chocolate. Who has a chocolate milk?
Right
Come
now.
on, who has a chocolate milk?
Like right now?
No.
And the handout. Okay. So I'm comparing those two. The milk and the chocolate milk both have sugar, but the milk has less sugar than the chocolate milk. Okay? The milk, in addition to that, have vitamin D, vitamin A, calcium, phosphorus. The chocolate milk has also the same thing. May not be in the same level, but also have those nutrients when it's fortified. So if you have to compare those two, the sugar content is the main difference. Okay? So now the other one, I'm comparing orange juice to soda. So again, it's obvious. So the orange juice, we have vitamins. Okay? We have small amount of protein, but we have less sugar than the soda, because soda basically it is water and sugar and some colorant. All right. So let's try to really see, based on what I said, the relationship between diet, what we eat, and our health. So basically, I'm going to focus on two parts, your gum and your teeth. Although the mouth have different parts, different components, I'm going to focus on those two only. So basically, if you look at your teeth, the teeth is made of an outer layer, which is the hardest part. Okay, and this is called enamel. This is very critical because it protects your teeth. Once you erode that enamel, you expose your teeth to cavity, risk of cavity and infection and so forth. So if you look at the enamel, it's made of two major things, calcium and phosphorus. Those are nutrients you will find where? In what food, typically?
Milk.
Milk,
Yes.
dairy product in general, okay? You also can find calcium and phosphorus in vegetable too. So in order for us to maintain that mouth, or the part of our mouth which is at the teeth very strong, we need to consume or eat foods that are rich in calcium and phosphorus. I added here, vitamin D also play an important role. Sometimes when you go to the store, you will have the milk bottle that says vitamin D fortified. Because typically milk doesn't have vitamin D, it's not a boost of vitamin D. So they have to fortify it, they have to add it to the food. Because vitamin D helps your body absorb calcium. So in order to maximize your calcium absorption and taking to making your teeth very strong, you need to really have vitamin D as part of your food. Calcium and phosphorus work together to mineralize your teeth and make it stronger. So keep in mind, so that if you have a poor diet that is lacking calcium, phosphorus, vitamin D, you're weakening your enamel. On the other side, if you have cavity, you can eat. So it's both ways. Diet has an impact on your teeth. And how healthy your teeth is, we allow you to eat and nourish your body. Okay, remember when you have food, you can eat, when you can probably easy having liquid food. You can enjoy some other food, you can eat vegetable unless they're blended. So there's a relationship between those two. We have to fill our body with healthy food in order for the body to be strong and healthy. What about the gum? Your gum actually is also very important in terms of your oral health. The gum is a part that protects the root of your teeth. It has to be firm in order to keep your teeth in place. Because if you don't have a firm gum, your teeth can be loose, then you can lose the teeth. You don't have any teeth, you can't eat. So again, here you can see the relationship. Now, what I want to talk about is the word that you may have probably heard about before, collagen. So your gum is made of soft tissue that are called collagen. These are protein. In order for your collagen to be strong, you need specific nutrient in the food. Vitamin C, vitamin K. Okay? You need folate. Those are very important because they allow your teeth to really be in place. Also, your gum is a barrier against bacteria and infections. So it protects not only your nerve down, but also the root. So in order for you to really have that protective gear, you need to eat food that really have those protective elements that can really be anti-inflammatory, such as omega 3 fatty acid that is really healthy fat. Okay? So this is what I really want to mention briefly is that, yes, what we eat impacts how healthy our teeth and gum are. If our teeth and gum are healthy, I can enjoy the meal and then nourish our body. There's a really tight connection between diet and oral health overall. Many of you have gone to the dentist this year. I'm seeing for the checkup, right? One thing we mentioned earlier about your routine, one of the things that I really mentioned is that keep up your routine checkup. How often are you supposed to go to your dentist in a given year? Twice, every 6 months. Now, again, this is a general rule, but there are cases where the person will need to probably treatment. Okay. So if you are a dentist and you have a diabetes, a patient that have diabetes, they become more than twice in a given year because when they have the diabetes, the teeth are more prone to cavities because the high sugar that they have as a part of the diabetes condition. Okay, so typically twice a year, every 6 months, but there are cases where they do more than twice a year. So let's look at briefly the food we eat. The food we eat impact our teeth and gum. How often you eat it impact our teeth and gum. And the way we eat it also impacts our teeth and gum. And here's what I mean by that. Yeah, you know for sure that sugary food, okay, or drinks, really allow our teeth to be in that sugar environment, which is really increase the risk of plaque building, tooth decay that lead to cavities. So if you have a patient one day and you want to care or try to guide them how they can really eat healthy and maintain their teeth in a good condition, you're going to look at the food they eat. We also have another type of food that can affect our teeth health and gum health. Those acidic food. That's the reason why I say that when we talk about the orange juice being in the middle, because it's very acid drink. And those also can erode your enamel if you expose that area of your tooth to the solution for that long period of time. So these are the two type of food that we have to keep in mind. Snacking all day long. There are people that are at the desk or watching TV or probably sitting in the park where they have their hand in something that keep going back and forth. There you go. It's an exercise for the arm, okay? When you go back and forth, you're not helping the mouth. So snacking 4 hours a day. It is one beer, the frequency at which we eat, that the daily should not be advised because it can increase the risk for tooth decay that can lead to cavities. Why? Because when we snack too much 4 hours a day, we expose the mouth to those foods longer than having a structure meal that is breakfast, lunch, dinner, and have a snack between one, instead of having this snack 4 hours a day or having to sip drinks 2 hours a day. The other thing that I just mentioned is that there is a way to consume our drink. People have bottles that they carry with them or soda, but they keep sipping it all the time. Again, here you expose the teeth to those sugar environments for long period of condition. So keep that in mind. What we eat, how often we eat it, and the way we eat. Those three food, like, will affect our teeth and increase our risk for cavity. Go back and ask you. This morning, you had breakfast, you have the 5 food that we notice here: bread, fruit, milk, potato, and the categorized in different food groups. Which of them you will think is have a high sugar content?
Carbs, fruit.
Everybody is speaking at the same time.
Fruit.
Okay, go ahead.
Cereal.
Cereal, have a high sugar, depending on the cereal you choose. Who said they ate cereal? Someone said that they ate cereal this morning. Did you eat cereal this morning? Who did?
Yes, I had cereal.
What type of cereal?
I had some tricks.
Hmm. Okay. So this is a mark. Okay? Cereal is a grain. It means a carbohydrate. Bread. Tricks is full of what?
Sugar.
How do you know if your food has sugar or not? What do you look for when you take the bus from the shelf?
The label.
Nutrition label.
Nutrition. I mean, I don't know.
Who has a drink over here? Okay, everybody has it. Okay. So basically, when you buy a packaged food, there is a square, a box on the package that tells you what is in that food that you buy. It tells you if you consume a cup of that particular food, what is in it, or if it is a whole one. Okay. Same thing for the drink. So you will have what they call the nutrition fact, which is a nutrition label on the bottle that help you. So next time you choose your cereal, look at the next cereal next to tricks and see if it is a better. Okay. Which of the food have a high acidity level?
Wait, what?
Orange. If you say fruit in general, pineapple is good, but pineapple have a very high, it's a very high, very high acidity level. Okay. Now, bread is a grain. It's good to have as part of the meal. What is the challenge with bread?
Wait, what did you? What?
What is the challenge with eating bread? When it comes to oral health?
Carbs.
Carbs, okay. What is a challenge with candies? When you eat candy,
Sugar.
sugar, but what else? Sticky.
There you go.
So bread has this risk also for being sticky. What is, out of all of this, what is the best of those foods that really are not going to create, again, they're not going to create any issues with food decay?
Vegetables, yogurt.
Egg. Does egg have sugar on it?
No.
Okay. Typically,
Yes.
foods that are high in protein and barely any sugar will not create any cavity issue. Not to say that you need to eat this, okay? Because some don't have carb. You don't have carb either, but it's not healthy. Okay,
Excuse me, Professor.
so what is the strategy if you were to see a patient or your friend about making changes to eat healthy, to keep the teeth strong and the gum healthy? Well, you will tell them, first of all, limit the sugary food, the sugary drink, and the acid. So if you have oranges, follow the oranges with water. Okay, or have the oranges while you're eating your meal as well. It is important to chew your food. The difference between having the smoothie is good and chewing actually the food, the one I mean the difference between food and drink is because by chewing the food, you create the saliva. The saliva is kind of a washing process. So the food will not stick in the teeth for too long. And our best friend of all is probably water. Water is the best friend of all the food choices. Again, brushing the teeth, like we mentioned before, depending on what you eat, and like we mentioned earlier, having regular doctor visit to check and anticipate or prevent any further decay that can be. I have next one.
Yeah.
Now we can do something quick. We have a few minutes left.
I just wanted to ask about clarification of snacks. Because we do know snacks dealing with the body, just the whole body, oral and the entire body. Snacks are good for increasing, healthy snacks are good for increasing metabolism. So were you meaning that not to eat snacks if you're not gonna brush your teeth afterwards? Could you elaborate on that? Please?
No, okay, so snack are good. So we have some example. The ideal for snack is, so basically in a given day, you have breakfast, lunch, dinner. Those are the three, right? And between, we need snack. Okay, so you have the morning snack, the afternoon snack. Your choice of snack has to be very important in the sense that do not choose cookies, okay? Do not choose candies. Do not choose those high sugary things unless you have unless you decide to go brush later, or floss your teeth or what have you. So having a snack is very important. I'm kind of surprised that, I don't have one slide I had. So basically, let me go back. We have 5 food groups, right? What is the difference between a food group and a nutrient?
Nutrients are in the food.
What is the difference between a food group and a nutrient? What is calcium?
A thing in milk.
What is calcium?
A nutrient.
You know.
So we have 5 food groups. And we have 6 classes of nutrient. The food group are your path to nutrient. In order to get your calcium, you have to get a food group that really is rich in that calcium. Right? So your dairy, your spinach are really a good source of calcium. You get vitamin D, you have dairy, but also you have mushroom. It's a very rich source of vitamin D. Okay. Now, when it comes to snack, the challenge with snack is that we want to get something to hold us until lunch or dinner, but we tend to go to the high end of the sugar bracket. We tend to choose snacks that are really sweet because we think we need that energy. But in fact, high sugar content food really are not helping us that much. It's going to be short lived. It's going to really help the energy for a short lived, then you're going to have to need to get more. So to answer your question, the snack, the ideal that I would recommend, have a nut mix, have carrot mixed with grape. Why those two go together? I would recommend is that carrot is a type of like apple you wash it off. If you have it with the dough that tends to be sticky, it will not reduce the stickiness of the dough. Okay? Did I answer your question?
Yes, ma'am. Thank you so much.
Okay, so let's tend to have those snacks that really will help us, but not too, say, let's say, high sugar level. Okay. So what we're going to have for lunch today?
What do we have?
We don't know.
You don't know yet?
We have
So what do you wish to eat for lunch?
Chipotle.
Chipotle?
I have a Chipotle.
I said I wish.
Oh.
Chipotle? What particular mean Chipotle?
Greek.
The rice, the pinto beans, peas, sour cream,
They have.
extra corn.
They're all 5
Remember when you go to Chipotle, it is not a different food, but it is what they add to it, like the sauce. It is very heavy cream, so keep that in mind.
Are you first on?
Any question? We're wrapping up now. Any question? So as you go, keep in mind the sugary food, the food that have very high in acid level, and the way you eat, not keep the food in your mouth too long. Do not sleep twice a day, not eat snack throughout the day. This good idea that allows you to really reduce your risk of tooth decay that will lead to cavity. Okay, it was nice meeting you. I hope we had a very good discussion and wish you the best for the rest of the comments. Okay. Hello, do you have any question? Sorry, I didn't mean to ignore you. Hello?
Can Cameron speak? Hello, can Cameron? Is he trying to tickle our feet?
No, it's gonna gradually come back. You think it's the split tickle? What's that?
He was like,
That's rude.
But you're smiling too.
There's no question, we're monitoring.
Okay.
Okay,
You know, what's it?
thank you.
Right. Oh, you know, Kim Magazine.